Hello, everyone. I'm Anthony Gonzalez, the Program Coordinator here at the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. I hope everyone is staying well out there, and I want to thank you all for joining us today for our webinar session titled Alcohol and Hazing, Examining the Intersections and Considering Implications for Campus Prevention. We have a few housekeeping slides we'd like to go over. We have switched to Zoom as our broadcasting platform, and we are excited about this switch and believe this will provide a better user experience. If I can direct your attention to the bottom of your screen, this is where you'll be able to submit your questions for our presenters. We welcome all of your questions, and please feel free to submit them at any time throughout the session. We'll field the received questions to our presenters at the very end. We also encourage you to learn more about becoming a member of the Higher Education Center, which includes access to our ScreenU program. ScreenU is a web-based screening and brief intervention referral to treatment program. We have launched a new demo of the program, so we encourage you to take a look. You can do so by searching go.osu.edu/ScreenU demo for access. And of course, you can learn more about the benefits of becoming a member by visiting our website at hecaod.osu.edu. And with that, it is my great pleasure to introduce to you our presenters for today. Joining us, we have Dr. Elizabeth Allan, Professor and Program Coordinator of the Higher Education Graduate Program at the University of Maine, Lauri Sidelko, Assistant Dean and Director of Community Life, and David Kerschner, a doctoral candidate and Waldron Fellow at the University of Maine. It's my pleasure turning it over to you guys at this time.
Thank you so much, Anthony. It's a pleasure to be with you all today. And this is Elizabeth speaking. I use she, her pronouns, and also wanted to mention, in addition to my affiliation with the University of Maine, I have a research team working with Stop Hazing and the Hazing Prevention Consortium that I serve as director for. So thank you all for taking the time today. It's really encouraging to know so many folks are committed to learning more about hazing and how it intersects with alcohol in a campus setting. As a reminder, we've designed the webinar content to meet the following, or to meet these learning objectives that you see on your screen. We'll start with defining hazing and identify its three key components. Participants will then gain familiarity with research findings related to hazing and college students and related to hazing and alcohol and hazing prevention. We'll review the Hazing Prevention Framework and describe how folks working in the AOD arena can help support campus hazing prevention. Next. So, our agenda includes the research highlights, as well as I mentioned, some of the information on prevention science, research-informed resources, and then we will conclude with some specific and concrete recommendations for practitioners. But before we get into the research highlights, I want to begin by taking a few minutes to review the definition of hazing. While hazing is a familiar term for many, it's often not used in a precise way. For example, it can be used in a joking manner, or it can be interchanged as a synonym for bullying. If we take a closer look, the more precise definition of hazing is it's any activity expected of someone seeking membership in a group, not only seeking membership, but also maintaining membership in a group that humiliates, degrades, abuses, or endangers them, regardless of a person's willingness to participate. There are three key components. Next slide. It's important to understand that while there's often different phrasing related to the definition of hazing, and there's some academic debate about how hazing should be defined, the definition that we just reviewed is a standard definition used as a basis for school and campus policies, state laws, and research. The three key components of the group context, if we could go back one slide, please. Sorry, I advanced too soon. If we could think about these three key components, we can break down the definition in a way that it might be easier to help folks you're working with understand it. We find this is really useful in trainings, especially because there tends to be a lot of confusion where you'll hear students talk about gray areas and you know, not taking the definition seriously or the policy seriously because they think pretty much anything can be considered hazing, which really isn't the case. If you look carefully at the definition, we see that hazing involves a group context. It also involves the potential for harm with emotional harm and physical harm or physical harm, and that it can occur regardless of a person's willingness to participate. So that third key component there, regardless of a person's willingness to participate, is what we want to take a closer look at on the next slide. So considering the definition of hazing, it's easy to see why it can be considered a form of interpersonal violence and a type of behavior that compromises student safety. Without adequate resources and commitment to hazing prevention, hazing can contribute to creating a climate where abusive behavior is normalized, and it can contribute to environments where other forms of violence and high-risk behaviors may be more likely to thrive. On this slide, you see the relationship between consent and hazing. You often hear students say, well, we gave people the choice of whether or not to participate. But in reality, hazing often involves a coercive environment. And that coercive environment is a product of the peer pressure and a strong desire to belong to the club, team, or organization, which the student is involved in or considering joining. And those of us who have worked in the area of violence prevention know that coercion can impede a true consent. So this third component of the definition is really important when considering hazing and working on trainings related to hazing. Many in the general public have seen news stories where the intersections of hazing and alcohol have been lethal. And when we think about hazing prevention, we're thinking about preventing the senseless and tragic loss of student lives, but we're also thinking more expansively about how hazing prevention is a key part of an overall comprehensive approach to student well-being, to inclusive campus communities, and to student thriving. So hazing occurs in the context of groups, as we've mentioned in this definition. And these groups are arguably the most salient living learning laboratories for student leadership development. If hazing is part of the group culture, what does it say about the leadership skills and perspectives these students are developing and taking with them into other arenas? This is why we focus on leadership in our hazing prevention work. Specifically, social change leadership and ethical leadership development are core strategies of hazing prevention at the individual level. And we have resources on this, which we can share with you if you're interested. So with this backdrop, let's take a closer look at the nature and extent of student hazing in a campus context. Next slide. So in our 2008 national study of college student hazing, we found that more than half of college students involved in clubs, teams, and organizations experienced hazing. In a more recent study that we published in the Journal of Student Affairs Research and Practice in 2019, we analyzed data from nearly 6,000 students at 7 universities who are participating in a comprehensive campus-wide hazing prevention initiative. The overall percentage reporting that they had experienced hazing behavior was lower than the national study at about 26%. One of the most common hazing behaviors was participating in a drinking game. And Dave will be talking a bit more about these findings in a few minutes. However, what was significant in 2008 and still significant today is that hazing is not simply an artifact of fraternity sorority life, as it's commonly assumed. According to the data from our studies and numerous others, hazing is more widespread and occurs in the context of many different types of groups and teams. Next slide. As you can see here, we found that varsity athletes had experienced hazing, students who were participating in fraternity sorority life, club sports, performing arts groups like marching bands, a cappella groups, service organizations, intramural teams, recreation clubs, as well as academic clubs and honor societies. Next slide. Aside from students involved in the groups or teams that might be hazing, we also found that students were very aware of hazing on campus, even if they weren't involved themselves. And we found that a gap exists between student experiences of hazing and their willingness to label it as such, as you see here in this visual. What we did is we designed a survey to ask about particular behaviors that were expected of them in order to join or participate in a group. We didn't use the term hazing until later in the survey when we asked them directly. So what you see here is the gap between those who experienced behavior meeting the definition of hazing and those who labeled their experience as hazing. We've been exploring this disconnect by gathering more in-depth data via interviews and focus groups during campus site visits. We've interviewed hundreds of students as well as staff, and some common themes that may help to explain this gap are next. So often we find that hazing is, or predominant images of hazing that are operating in the way people think about it tend to be limited to physical forms of hazing and physical harm. When hazing results in a tragedy or severe physical harm, it's common to hear that behavior described as hazing because it tends to be that predominant image or fit that predominant image of hazing. It's also rare in those cases to hear hazing be justified or minimized. However, when hazing takes different forms, where there may be more emotional harm that's not visible necessarily to the eye, then there's less clarity. We often hear justifications and rationalizations for those types of hazing. Like other forms of abuse and violence, hazing occurs along a continuum. Next. Here you see our visual called the spectrum of hazing. And in this visual, you see the proposed relationship between the type of hazing behavior as well as the frequency and level of recognition. All of these hazing behaviors meet the definition of hazing. Yet, in some cases, even today, when hazing behavior is uncovered, you'll hear people justify or rationalize it using euphemisms like, that wasn't hazing, that was just a prank, just a tradition, just an antic, or boys being boys. And those are the kinds of reactions you often hear when the hazing behavior could be characterized on that left side of the continuum. Whereas on the right-hand side of the continuum, there is a much higher recognition of that behavior as hazing, but we believe a lower frequency of that type of behavior. So this is important, obviously, for prevention, because the behaviors, the kinds of hazing behaviors that occur with higher frequency and thus we have more opportunity to intervene as bystanders, for example. These kinds of behaviors have much lower recognition. And so one thing we're really working on, and we'll be talking more about, is how to help members of the campus community expand their understanding of hazing and expand those predominant images of hazing and understand why all of these kinds of behaviors in the context of hazing can be harmful. So with this backdrop, we turn to a short summary of the research highlights, and Dave will provide us with this.
Hi, everyone. Dave Kerschner. I use he, him pronouns. So building from that background information and overview of many of the key findings of the 2008 national study and our research, I want to take a moment to examine a bit further scholarship focus on hazing and alcohol misuse and examine the themes that are present in that extant research. But before we begin, I think it's important to note that when we look at this scholarship, it has to be acknowledged that one major limitation is that it tends to be focused on white student groups at predominantly white institutions. So please keep this limitation in mind during this review. But as you can see from the quotes that we've shared here, scholars have long noted the link and amplifying effect between alcohol misuse and amplifying effect alcohol misuse may have on hazing. And so the first theme present in the literature examining alcohol misuse and hazing is the link between alcohol, hazing, and serious injury or death. Hank Newer documented 210 deaths on college campuses due to hazing and alcohol misuse between 1969 and 1999. And in a study of emergency room visits, Finkel noted the role of alcohol and binge drinking that they may have in many of the hazing behaviors that ultimately resulted in those emergency room visits. One study found that 90% of hazing deaths involved extreme alcohol consumption, and another found that 85% of hazing-related deaths were due to accidents for which alcohol intoxication was frequently the cause or a significant factor of the fatality. Another theme from the scholarship in this area is that alcohol consumption is a common hazing practice across student groups, with high percentages of students experiencing alcohol-related hazing. In the 2008 national study, Allan and Madden found that in order to join or maintain membership in their groups, organizations, or teams, 26% of students reported participating in a drinking game, and 12% reported drinking large amounts to the point that they got sick or passed out. Students participating in varsity athletic programs, social fraternities and sororities, and club sports were the most likely to report alcohol-related hazing. And men tended to report higher percentages of alcohol-related hazing than women. Other studies that have looked at hazing in a post-secondary context have found similar results, with between 17% and 28% of students indicating they experienced alcohol-related hazing across a variety of student organizations. There's some evidence that suggests that students are maybe experiencing alcohol-related hazing in high school and perhaps sooner. For instance, studies have shown that students report participating in drinking games and drinking to the point of getting sick in order to join or participate in groups, teams, and organizations in high school. Looking further at student experiences with behaviors similar to hazing and alcohol misuse, it's worth noting that in a 2013 study that examined the relationship between school bullying, work bullying, and changes in alcohol consumption and alcohol problems for college students, that 43% experienced bullying at school, and that school bullying consistently predicted alcohol consumption and problematic drinking. And this was with 2,000 students across 8 colleges and universities in the United States. And many of the behaviors that were included in this were similar to what we'd asked students about their hazing experiences. And so those bullied were more likely to drink to intoxication and binge drink, and those that were bullied exhibited a higher mean number of days drinking alcohol, average number of drinks per day, and just general problems with drinking when they followed up compared to those who were not bullied. In another study, Hoover found that more than half of varsity athletes were involved in alcohol-related initiation activities, but only 12% considered those activities to be hazing. And this leads into our final theme from the research, and that's that students generally don't recognize hazing behaviors involving alcohol as hazing unless they're physically forced to consume the alcohol. And so while scholars have noted that students across various types of organizations will say, yes, I was hazed if they're forced to consume alcohol, students don't perceive it as hazing if they're given the choice to opt out. And this finding really ties into what Dr. Allan presented earlier about the inability of students to recognize hazing unless there's that physical force, and it ties into that three-part definition of hazing. So with this research review in mind, we want to shift to providing some background information on prevention science, and also provide some information on how the Strategic Prevention Framework and the work of the Hazing Prevention Consortium ultimately informs the Hazing Prevention Framework and many of the research-informed resources that we'll share later that you can use on your campuses. So to start, some background as for what works in prevention and principles of effective prevention programs. Nation and colleagues used a review of reviews approach for studies across 4 areas. Those areas were substance abuse, risky sexual behavior, school failure, and juvenile violence. And they identified 9 characteristics of effective prevention programs that were consistently discussed in the prevention science literature. The first 5 listed comprehensive, varied teaching methods, sufficient dosage, theory-driven, and positive relationships. Those are program characteristics. The next 2, appropriately timed and social culturally relevant, are associated with matching the program to the appropriate target audience. And the last 2 are associated with implementation and evaluation. And so with that, we want to move forward to some questions.
Hi all, this is Lauri Sidelko. I use she, her pronouns, and I'm just jumping in for a minute. I'll be back later, but I just wanted to take and invite you to ask any questions that you have. Also, let us know if your campus has hazing prevention efforts, and if so, are you involved with them, or how are you involved with them? And you can put those into the chat, the Q&A, and we will get to those as we go along. Looks like there might be, I think we're good for now. Next slide.
Thanks, Lauri. So before we review a couple of key frameworks that we've been using in our research, I wanted to just reiterate that if you think about the definition of hazing and the research findings we have reviewed so far, it seems pretty clear that without adequate resources and commitment to campus hazing prevention, hazing can contribute to creating a climate where abusive behavior is normalized or minimized or more likely to be. And it can contribute to environments where other forms of violence and high-risk behaviors are more likely to thrive. And it's with this in mind that we really are working to illustrate and highlight the intersections between hazing and, for example, and other high-risk behaviors and or forms of violence like sexual violence. And today our focus being on alcohol misuse. So when we turned our attention but in addition to looking at the nature and extent of hazing, to also designing research that would explore hazing prevention in a campus context, we drew upon a couple of key frameworks. The first being the Ecological Framework, which I'm sure many of you are familiar with. Here you see an adaptation of the Ecological Framework for hazing in particular. So looking at the individual level or the student level, we might look at skill building around leadership or around bystander intervention. At the group or organization level, we might look at advisor training, group policies, opportunities for group dialogues and trainings and so forth. At the university or community level, of course, bystander education, again, bystander intervention education, as well as adequate policies and the enforcement of those policies. And of course, transparency related to accountability for hazing. And then, of course, we need to also be thinking about beyond the university community in considering alumni, parents and families, and just, the policy arena at the state level and beyond. Next slide, please. So before we had a hazing prevention framework, we began our efforts keeping in mind the strategic prevention framework developed by SAMHSA. And you see here the visual. Many of you are probably familiar with the strategic prevention framework. Some people refer to it as SPIF for short. And you see the paddles of the fan here and the ways in which these different components work together around sustainability and cultural competence in community-based prevention work in general. Next slide. And so what we wanted to do was to test what would hazing prevention, a comprehensive approach to hazing prevention, look like if we were to employ the principles that Dave reviewed from the Nation et al. Study, if we were to also view our work and design our work through campus ecology, the socio-ecological model, and the strategic prevention framework. What would we find? How would it work? And so we did that in our first cohort of the Hazing Prevention Consortium that included 8 pioneering universities who partnered with us to participate in a 3-year research to practice initiative. And in that 3-year time frame, we worked with these 8 universities to implement a comprehensive approach to hazing prevention on each campus. And we also worked to document everything, including individual strategies, as well as systematically documenting the process of comprehensive hazing prevention. Analysis of many forms of data over 3 years in that first cohort yielded a framework for hazing prevention, which we'll talk about in a minute. The full study and findings around that framework are reported in a 2018 research article in the Journal of Student Affairs Research and Practice. And as I mentioned, a number of campuses are were involved in that initiative in that first 3 years. And now we have a number of other campuses who are helping us implement and iterate the hazing prevention framework and the tools and resources we've developed that have emerged from the work of that first cohort of the consortium. You can read more about the 3-year design and HPC partnership by going to the stophazing.org website, and in the drop-down menu and the research tab, you can find more details there. Next slide. So, building on the foundation of the strategic prevention framework and the campus ecology model and the principles of prevention science, and through those lenses, analyzing our data from the first 3-year project, we were able to propose this hazing prevention framework. And you see here many similarities to the strategic prevention framework in terms of the interrelatedness of the components, the fact that it isn't linear, the fact that it's iterative, it's fluid, it's dynamic, each component informs the other. They can't necessarily be implemented, in a one-size-fits-all manner. And which is why we very much take into account the campus culture, the unique traditions and history of every campus. And that is considered under the commitment component of the framework. So we have 8 different components. All of these are also features of the strategic prevention framework, except for the commitment. The commitment component is unique to the hazing prevention framework, and it is one that we found through our data analysis was vital to creating effective efforts for campus-wide and comprehensive and sustainable hazing prevention. You can read more and learn more about the Hazing Prevention Framework by reading the research article, but also, next slide, please. We have other resources that build on the framework, including the Hazing Prevention Toolkit and a hazing prevention rubric. And Lauri will be saying a bit more about those. We are also going to be, after that, reviewing some research findings relative to the film We Don't Haze, which we have evaluated. There is another terrific film that has also been evaluated called Intervene. So we'll be saying a few words about that. That was produced by folks at Cornell University. And then we will share a resource about how to recognize potential signs of hazing and with the students you're working with. Next slide. So this is an image of the Hazing Prevention Toolkit. You can access this through the stophazing.org website. It is also found on the Clery Center website. This was an effort that was a collaboration, a partnership between Stop Hazing and Clery. And so you can find these resources in both places. The toolkit is designed to be a quick glimpse and overview of each of the components of the Hazing Prevention Framework. It has concrete action steps as well as characteristics of each component. And it also has some scenarios that are included to help practitioners think about how to apply the components into their everyday work with students. Next slide.
Okay, so this is Lauri again. I just wanted to say in response to what Dr. Allan was discussing is that I was part of the Hazing Prevention Consortium in cohort 1 as the liaison from the University of Maine. And so we were very involved in the development of the early stages of the toolkit and the rubric and things of that nature. And I'm going to talk a little bit about the toolkit. Again, that can be downloaded from the Stop Hazing website. And the document is actually, I use it in practice all the time. Before my current position, I was the Director of Student Wellness for 15 years. And I used that document from the time it came out until very recently to kind of take groups through all of the steps of the framework. As Dr. Allan mentioned, it is based on the Hazing Prevention Framework. And you can really use the document to go through and see, kind of assess how it is that you're doing, really understand all of the different steps of the framework, and kind of take people through your campus to see where you're at and where you can go. So commitment was the first component of the Hazing Prevention Framework, and capacity is the second. So I'm going to talk about capacity for a moment. Of course, if you look at the Strategic Prevention Framework, then capacity is part of that. And so if you are familiar with that, then you'll be familiar with this idea of essentially capacity is just really looking at all of your resources on campus and getting buy-in and making sure that that you have a coalition of people, whether that's a hazing prevention coalition or people who are prevention minded at first, who will help you spread the word and make hazing prevention something that you know that is something that you want to focus on. So capacity building might be building a coalition. It also is building a network of support. It's getting other people involved. It's making sure that people understand that hazing prevention is an expectation and part of a conversation that you're having on your campus, and that your tolerance level for hazing is not something that that you're going to allow on your campus. So from capacity building really starts from the beginning, whether it's employee orientation or student orientation, from the beginning of when your students arrive, and can carry through all through graduation. I mean, there certainly are components of hazing that carry out throughout a student's career, but also for your staff and employees throughout their career. So next slide. So another component of the toolkit that we've researched is the assessment. So whether that assessment, when we worked with the Hazing Prevention Consortium, our assessment happened through the consortium. So what that looked like was we conducted a survey with our students and faculty and staff, and we did interviews. We did a document review. We did a cultural assessment of our campus. We did all of those things so that we could take a look at what is our campus, what do the people who are at our campus think and say and feel about hazing. We are assessing the campus culture. Or you can do that in a self-assessment. Prior to our being involved with the consortium, we also regularly surveyed our students. We did some focus groups. You really want to know what it is that your campus is saying about hazing, because then you can address that and address the reality of what people feel about hazing on your campus. Next slide. So, and again, cultural competence is another area in the prevention toolkit. And in using this toolkit, one thing that I found is I typically just print out the document and take people through it step by step, because something that is often, particularly on a predominantly white campus like my own, people don't necessarily think about the intricacies of a group. They kind of create one-size-fits-all strategies that don't necessarily address the personality and the identity and the characteristics of a particular group or organization or team or whatever the group might be. And so that's where cultural competence comes in. You're assuming that a one-size-fits-all approach doesn't fit the needs and the problems of your group. It takes into account power dynamics and inclusivity. And so it's more representative of your stakeholders. Next slide. So the rubric is also came out of the consortium, and the rubric is essentially, it's a checklist. It's research practices. It's kind of taking you from the beginning, the developing and advanced and exemplary pieces of work that you're doing with your campus. So last year we did a policy review. We hadn't done a policy review of hazing policy in quite some time. And so we took the rubric and assembled a team of people, and you can take people through in a checklist and say, where is my campus at? And it really is a discussion guide. So you can say, you can go through and check the steps and say, wow, we're at the beginning or the developing stages of this, of our work in hazing prevention in these areas. And then you can create a to-do plan, places where you can say, well, our commitment isn't as strong as it could be with, say, senior leadership or faculty. And you can you can take this checklist and work through where you're at in your process in developing hazing prevention. Next slide. The same is true with implementation. So if you're working through the steps of what you have done for your programming, you can go from beginning to developing, advanced and exemplary, to see if you're in the, where you are in the development of your strategies, and your target audience can take you through, it can take you through where you want your target audience to be and what outcomes that you're looking for. Next slide.
So two other research-informed resources we want to share are the evaluated films We Don't Haze and Intervene. Starting with We Don't Haze, it's an approximately 15-minute long hazing prevention film produced by the Cleary Center that features messaging from parents that have lost a child to hazing.
I can jump in to explain that the film We Don't Haze has been evaluated. We evaluated it on 3 different campuses, and we used an approach that included 2 experimental groups and a control group. And we found that a number of learning objectives we were able to achieve them through the use of this film with a number of different types of student groups. So we tested it with fraternity and sorority members. We tested it with club sports. We tested it with a leadership group and with resident assistants at another university. And again, we have reported on the findings. We've also evaluated it in high school setting, and we've reported on the findings. You can find the details of those in several different articles, as well as conference presentations, and we are happy to share those if you are interested. So
Elizabeth, I think it's also important to say that this film was, when it was evaluated, it was found to be effective both as alone as a video being shown, as well as with the companion facilitation guide. And I know that I personally have used it both ways. When I have a large all Greek meeting, for example, then I've used it to show the film when I didn't have a lot of time as a follow-up for facilitation, but I've also used it to facilitate with smaller groups.
thanks, Lauri. And it is a 17-minute documentary style film. It's available free of cost. You can find it on the Stop Hazing website or the Cleary Center website, both places. And as Lauri mentioned, it includes, there are a number of companion resources associated with it, the facilitation guide, a bystander intervention guide, and several other tools that can be used in conjunction for trainings if you're interested. Next slide. Dave, are you there? Do you want to jump in?
I advanced your slide, Dr. Allan. I'm not sure if Dave is here with us or has still experienced some Zoom technical issues, but I'm able to advance the slide until he's able to join us again.
All right, terrific. Thank you. So this slide is a visual of the film called Intervene. Many of you may have seen this presented at a number of different conferences. Laura Santacroce from Cornell University has been sharing it widely, and it includes a number of different topics for bystander intervention. So it isn't specific to hazing like the We Don't Haze film is. It is, but it does include a hazing scenario, which you see pictured here on the right. It's an excellent film. It has also been evaluated in a randomized control design, and we highly recommend it as well. Lauri, did you want to jump in, say anything about this as well?
Sure. I like this film a lot because if you are using it with bystander intervention, or if you're using it in an interdisciplinary way, then you can use all of the videos all together and use their facilitation guide. But in addition to that, you can also just use the vignettes as needed. So it's great when you want to just do an alcohol overdose, or you want to do a hazing prevention vignette, or if you want to use a scenario and debrief the scenario. So it's really very flexible in terms of use of the video.
Thank you. So those two tools, the We Don't Haze and Intervene, are excellent and research based. They've research informed and also evaluated resources that may be useful to you. Next slide. So we have a question. We'd love to hear, do you currently include hazing or hazing prevention as part of your bystander intervention trainings? Please type into the chat. Let us know. Thanks.
Okay, we can move to the next slide. So some folks, there's one question in the chat, in the Q&A, that's what's the best way to start hazing prevention efforts on your campus? That's something that we can address a little bit at the end, but I would say just in the beginning, if you take the framework and the toolkit that are available on the Stop Hazing website and start to work through that, it starts with commitment, it moves to capacity building. It basically is a step-by-step process on how to do hazing prevention work on your campus. So that's a great place for us to start. Some of the tools that we have available and the resources that we have available are, for example, is this Hazing Red Flags. So this Hazing Red Flags slide, we have two slides actually that we'll be sharing, is available also on the website. But this is something that we use at the University of Maine in our bystander intervention. And we do it because it's a really good way. If people say, well, I have no idea, hazing is so secretive, this is not something that I'm aware of, and how would I ever spot it? So this is a good thing for bystander intervention to alert people to hazing red flags. And of course, some of the things that are listed in these red flags might be red flags for other situations, but it certainly is a way to say, I'm thinking twice about a student and I have some concerns about them. So maybe I should put some of those concerns together, document them, and see if there's any kind of connection to a student organization or any kind of pattern of behavior that could be related to hazing. And that's a great way for you to start to explore hazing prevention and what you might do about that. So I'm not going to go through these. These are, again, available on the State Stop Hazing website, but it's about the red flags and allowing people to have a place to report those and teaching them how to do it in bystander intervention. Next slide, please. So again, these are some other red flags that indicate some hazing might be happening. If you're looking at official reports, that's one way to do it, although we know that the reporting of hazing isn't as prevalent as the actual hazing. So you might want to look about the reputation. In the third bullet, we talk about the reputation about hazing. And this again goes back to some of the things that we talked about in assessment. Even if you don't do a comprehensive assessment of your campus, it's good to know what the reputation of groups and organizations are and what the hazing reputation on campus is, because students will talk about, even if they don't want to talk about their own organization, they will talk about things that they have heard about other organizations. And it's a great place for you to look at those red flags, teach students what they need to do about those red flags, or faculty and staff for that matter, and then move to the next step, which is working on programs and prevention strategies. Next slide. So in terms of recommendations, when you're working through the Hazing Prevention Framework and you're working through the toolkit, you want to consider your audience and be comprehensive with your approach. Next slide, please. So when you're working with students, you want to ask some probing questions. You want to ask them, if you're familiar in alcohol education, we use the motivational interviewing techniques. If you want to ask open-ended and questions where you're asking students to give you more information about what they're talking about, some information about hazing might surface, or at least one of those red flags might surface. So that's a good way for you to approach that audience. Making resources available. I know that frequently we meet with students for basics on one-on-one meetings, and just having a hazing prevention poster up on your wall when you're speaking to those students, or having information readily available all over campus, that conveys your message that hazing is not something that you tolerate and that you're open to having a conversation about it. Again, we've talked about building bystander intervention skills, and we have incorporated the hazing prevention into our peer education training program. You want students to be comfortable with the topic and to be able to talk about it regularly. Next slide, please. Again, with colleagues, this is about capacity building. Some colleagues don't think about hazing prevention, nor do they think that it's part of their job or that they should be thinking about it. I believe that hazing prevention is work that we all need to be doing. And so you can take your expertise and you can share that with your professionals, your coworkers. You can put it into job descriptions or find places where being involved in your hazing prevention committee, for example, might be part of a job description. Look for ways to collaborate, add it into employee staff trainings, or getting it on the agenda for different staff meetings. I know I put it in our town meeting recently for student life, just to say, hey, remember this, that we're still doing hazing prevention, and I want it to be on your radar, and I want you to be thinking about it. It's a great reminder for our staff to keep looking out for those red flags. The other thing is that if hazing comes into federal law, which we hope that it will, we believe that it will be part of Clery reporting. And so I know that at our institution, we've already changed our Clery reporting structure so that it includes hazing. because we want to be really clear that this is something that's important to us. We're educating people on it, we're tracking it, we're paying attention, we're providing investigations, and we're following up. Next slide, please. And then we have to look at our support networks in and around us. Alumni, families, parents, guardians, things of that nature. We want to make sure that when we're working through hazing prevention, that they are on the same page. So we put things out in our parent newsletter to say, here is what hazing is, and here are the things that we're doing about it. And if you hear something or if you have concerns, then please let us know. You can build those bystander intervention networks in those groups as well. Webinars, web pages, all of the resources that you can, and talking about intersections between hazing and alcohol. Because often if a student is talking about joining a group, you can ask that question in those groups to say, is there alcohol involved in your intake process or your beginning process? So an alumni also, especially if your alumni are highly involved in coming from the 80s and the 90s culturally, they might have a strong feeling about hazing. And so it's good to work with those groups. I often have those groups come in, and when they come in, I say, so alcohol and hazing look very different than they looked perhaps when you went to school. And so we want to start out by talking about what it is that we do and what our expectation is of our organizations, because we don't want anyone to get hurt in our groups. Next slide. Advisors to student organizations. Most schools have require student organizations to have advisors, and so we have found that this is a great place to have conversations. Advisors vary in their involvement in student organizations, but it's good to determine what their knowledge is and let them know what your support and what you can do to help them in the group, to train them and teach them about both alcohol misuse and hazing and intersections with that. Next slide.
All right, so just to wrap up, we want to return back to the learning objectives. And we hope that this webinar helped you learn something new or reinforce and extend prior learning, gave you some good ideas and suggestions for where to find more research-informed and research-based resources. We have more resources and tools available at Stop Hazing, so feel free to be in touch. We also didn't have time to review all the different, all the excellent research that is growing and developing in this field. You can find, we've reviewed a number of studies and more than what we've been able to talk about here. And we've written about those in Jason Merriweather's new book. So you can find that chapter there if you want a more extensive lit review, as well as an AFA white paper that's coming out soon from the Association of Fraternity and Sorority Advisors. Next slide. We would love for you to stay in touch with us. Here are some ways you can do that. And I also want to be sure we have a couple of minutes for questions. I saw one come in from the Piazza Center, I believe it was Steve, who asked about antecedents to hazing. Great question. And I just wanted to mention, again, there is some excellent research out there. Folks who are looking at moral development, for example, Gentry McCreary's work, folks who are looking at gender and toxic masculinity, in particular, Adam McCready. I've written about that. There are a number of others. Gregory Parks has done some excellent research related to hazing and potential cognitive factors and other factors, cultural factors. So there's a lot of good work out there, and we hope that you continue to explore the research and how the research can inform your prevention efforts.
I also wanted to add that this we didn't have enough time in this webinar to really talk about all the vast complexities of hazing and hazing prevention work. So we are going to be offering through Stop Hazing some open office hours, essentially, so people can have some Q&A time with some of the people who work for Stop Hazing. We can talk through some of the specific things that you're worried about or getting started and things like that. And so those are going to be available, listed out on our website.
Perfect. So as they share, now is your time to ask questions. So please feel free to submit them in the Q&A box or in the chat screen. We did have a few that came in throughout the session. So is there a component of this program to address incoming students to inform them of hazing behaviors?
So essentially, I go back to the toolkit. The toolkit essentially is a step-by-step process, and you can take and pick and choose and build programs and trainings based on that. So in terms of informing students of hazing behavior, you can look at all the different pieces of that. You can talk about the commitment that you have, your institution has to hazing prevention. You can give them the definition. You can use the hazing study to talk about what the national statistics are and were for hazing behavior on campuses. And then you can get into your policies and procedures to talk to students about hazing.
We've had several people put in the chat about accessing the rubric, and so I just wanted to throw it out outside of the chat. So Dave has been active in the chat and putting that in there. You can just reach out if you want access to the rubric to info@stophazing.org. And you can, for the rubric or information about office hours, so you can do both of those. Email for both of those, the rubric and as well as office hours. That's info@stophazing.org is currently on the screen.
Just jumping in with regard to the last question for incoming students, there are a number of folks working on, for example, online curricula that could be shared. There are other folks working, University of Texas Austin is pioneering an outreach program to parents and families of high school students who are at feeder schools to the institution, and they're starting there talking about hazing and hazing prevention. So there's a lot of good work being done. We highly recommend addressing this issue in new student orientation programs.
Dr. Allan, this is for you, is not necessarily a question as much as a favor. You were mentioning several researchers that have done great work on hazing as you were answering the question from the Piazza Center. Would you be able to put those researchers, the names in the chat so people might be able to research and kind of look up their work?
Absolutely. I'll do that right now. Sure
Awesome.
thing.
Thank you so much. The next question we have, and I know we're running out of time, and so is it okay if we ask 2 more questions before we go? Wanted to make sure for our presenters that understand that for people attending, we may understand you may have to leave for different meetings, but for Lauri, Dr. Allan, and Dave, is it okay if we ask a couple more questions?
Sure.
Absolutely. So one question we had is, what evidence-based post-interventions exist to re-educate groups who have been found responsible for hazing?
I'm not aware of anything that is evidence-based. Typically what happens in a group that's been responsible for hazing, that you do have to start all over again. I've worked with a number of groups who have been suspended altogether. And so we make part of their re-recognition plan an educational program that begins to break down the behavior and tease out what is tradition and what is hazing and start all over again.
And I'll just say, my apologies for the technical difficulties earlier. My internet dropped out, but one thing that I was going to share around We Don't Haze is that we would love to expand that evaluation to groups that have perhaps been found to be responsible for hazing or other, at-risk groups. So while that isn't an evidence-based post-vention at the moment, if that is something anyone out there would be interested in partnering in or working to evaluate that further in another context, that's a conversation we'd love to have. And please feel free to reach out to us at the email address provided if you're interested in that.
And our last question is more so for Lauri, thinking about your experience working and running a wellness office. And so you touched on it briefly. I just wonder if you might be able to expand a little more. So the question that we got came in is, where does hazing prevention kind of fit into an overall wellness office? And what does that kind of collaboration look like across campus from a wellness office perspective?
Sure. If you look at, depending on what framework you use for wellness, the wellness wheel or the spectrum or whatever it is that you use, if it's not included as part of that, we make sure that it is. When we are looking at how we want to, what our hierarchy of needs and training students are and kind of getting them ahead for success, we think about the trifecta, which is AOD, alcohol and other drug education, Title IX education, and hazing prevention. And so that's how we approach our hierarchy. And then, of course, with wellness and health promotion, it's difficult to have a health and well group, healthy and well group, if hazing is part of that. If some of your members of your organization are hurting, or they're being excluded or hazed or abused essentially to become part of the group, then that's not part of a holistic group. So a lot of times when we go meet with our students in the early pre-induction meetings to do educational programs, that's what we focus on. We focus on that health promotion and support, and that it's not possible to be a healthy group if you're participating in hazing. And also, what are the values in your group, and do your values support hazing? Because if you have espoused values that are about being a positive and productive group, then hazing doesn't fit with that. And so it actually fits quite well in the wellness work. I often take an interdisciplinary approach to hazing because it's, as everyone knows, it's very difficult to just focus on one particular abusive behavior or something terrible that's happening to our students. And so it's really easy to like the intervene video, to look at all sorts of approaches to what our students will encounter, and what overlap. There's sexual assault overlap in hazing, there's alcohol abuse overlap in hazing. And so to really look at that really holistically and talk to our students about how these are the things that we are going to eliminate from our practices, and how do we do that.
Well, thank you to all of our presenters. That is all the questions that we have. Thank you so much to our presenters for taking time out of your busy schedules to meet with us and to share all those resources in the chat, and for sharing your contact information. Thank you so much. We just have a couple of housekeeping slides before we wrap it up for today. We hope you can join us for our next free webinar titled Vaping Their Brains, E-Cigarettes, and the College Community, taking place July 8th at 2 p.m. Eastern Central Time. You can register by following the Go link on the screen. We also have an upcoming topic-focused virtual water cooler chat taking place July 7th at 2 p.m. Eastern Central Time, and this will be focusing on working with residence life. You can learn more by visiting our website at hecaod.osu.edu. And we're also excited to announce that the registration for the 2020 virtual national meeting is now open. Although we are unable to meet in person this year, we are excited to bring a virtual conference experience geared for campus professionals working in the field of substance misuse prevention and collegiate recovery. Join other attendees for the opportunity to learn about issues impacting collegiate substance across the continuum, evidence-based practices, and how to implement them in a sustainable and impactful way, as well as networking opportunities to meet others from across the country. You can register by following the Go link on the screen, or also by visiting our website, hecaod.osu.edu. And just a reminder that this session's recording will be uploaded to our website and YouTube page within 4 business days of the live session. Thank you again for everybody that was able to join us today, and we wish you well.